Hey everybody, it's Dr. Cheng Ruan here, broadcasting to you live on Facebook. If you're watching this on replay, thank you for watching this on replay, wherever you are in the world. If you don't know me, my name is Dr. Cheng Ruan. I'm an internal medicine physician here in Texas, and today we're going to talk about something of a controversial topic, which is gluten. And gluten is sort of all over the news. Gluten is all over the grocery stores you go to. Every mom and pop shop, not even the small grocery stores, has some gluten-free options that are labeled gluten-free options. Well, what exactly is it? Why are we concerned about it? Is it a fad, or is it just a marketing ploy for people to make money? And all your questions will be answered in this video if you just gotta watch to the end. So in this video, I'm gonna talk about exactly what it is, whether it's a fad or not. Are there any dangers to going gluten-free? Who should go gluten-free? And what are the health benefits from going gluten-free? So you're going to learn about all this in this video. So here are my tips for going gluten-free. Now, what exactly is gluten? Gluten is a substance that we ingest, and it's commonly in wheat, it's in barley, and it's in rye. And so when this substance that we ingest, called gluten, just like everything else that we eat, does something to our body. Everything that you put into your body is going to harm you or is going to help you, and there's not much in between. And so the concept of gluten really started when we were identifying people with something called celiac disease. And celiac disease are those people who have a really bad reaction. They cannot break down or tolerate gluten, and that causes like severe inflammation, not only in their gut, but in their entire bodies. Now, that is very different from somebody with gluten intolerance, and gluten intolerance is far more common. So how do you tell the difference between celiac disease and gluten intolerance? So people who are gluten intolerant can have similar symptoms to those with celiac disease, but most of the time they don't know because they're so used to it for so long. People with celiac disease, sometimes they can develop antibodies that can be detected in the blood work, but just because it's negative doesn't mean that they don't have celiac disease. They really need a colonoscopy and a biopsy to really diagnose celiac disease. Those people who are gluten intolerant are those people who may not have any evidence of celiac disease, and they test negative for celiac disease, but they have other symptoms, and those symptoms we'll talk about in a bit. All right. And so people who are gluten intolerant, most people don't know that they're gluten intolerant until they try a gluten-free period and they feel better. So what are some symptoms of gluten intolerance? The symptoms of gluten intolerance are sometimes you can get abdominal bloating, you get abdominal pain, you get rashes, joint pain, worsening, eczema, asthma. You can get basically a lot of inflammation in the body, and that inflammation actually causes a lot of inflammatory markers to go up, especially some of the cardiac inflammatory markers, and they can be at risk for heart disease and strokes and a lot of vascular diseases. And the people who are gluten intolerant are used to being feeling a certain way, and because gluten exists in a lot of different foods that is in the American diet, when they're being constantly exposed to it, they think it's normal for them to feel that way. Fatigue, weight gain, joint pains, muscle pains, bloating, either constipation or diarrhea, because the gluten can cause a lot of these symptoms, but that's not the whole picture, and I'll tell you why. So even though we're talking about gluten, I don't want to just focus on gluten. I want to focus on actually whole eating and healthy eating. The problem with the label of gluten-free in America is that a lot of things that are labeled gluten-free are still processed. They're still junk. They're still toxins. And when they put them on the shelves, if someone's labeled non-GMO, gluten-free, and organic, people think that it's healthy for them, and that may not be necessarily true. A lot of sugars that are processed, real processed sugars, are gluten-free. They're labeled as such, but they're not necessarily true. So there's a lot of buzzwords in the American public that will make people think that it's a healthy. For example, fat-free, which I really hate, gluten-free, non-GMO, and low carb, when in actuality they have sugar substitutes. All these things, or diet, or zero calorie, and all these things are labeled because they replace it with something else that may be processed. And so my rule for people is that a lot of people want to go gluten-free, but they may not be doing themselves a favor, because if they're still eating processed gluten-free foods, they're still eating processed foods that may have a lot of toxins for them. And so in that aspect, it's kind of a fad. And the fad comes from the fact that there's a lot of people who make a lot of money marketing gluten-free items, and people doing a lot of celebrities even having gluten-free cookbooks, gluten-free shows, gluten-free items they have on there. And just because it's gluten-free does not mean that it's not bad for you. It may be processed another way. So the rule of thumb: eat whole foods. If it comes from the ground, if it doesn't have gluten in it, if it's one of the other categories of food, grass-fed beef, if it's eggs, right? If it's vegetables, these are whole foods that you can eat to ensure that you stay in good health, while avoiding a lot of these things that are labeled gluten-free because they still might be processed. So yes, there's truth in gluten intolerance and gluten causing a lot of inflammation in the body. But there's also truth in that there's a lot of companies out there that are manipulating the system for gluten-free items to be labeled, even though they're not that good for you. And I hope that makes sense. Another thing to really think about is I do prescribe a gluten-free diet in a lot of my patients. And so who are these perfect people for them to try a period of gluten-free, and how long should they try it? So I think the perfect people to try a gluten-free diet are those people who have type 2 diabetes or pre-diabetic, who have autoimmune diseases like Hashimoto's and Sjogren's and lupus. Those people who have recently gained a lot of weight and want to lose some pounds, they should try a gluten and grain-free period. Those people who have a lot of inflammation in the body, they're on chronic pain medication for fibromyalgia, with the complex regional pain syndrome, and also those people with post-traumatic stress disorder, those people with generalized anxiety disorders, major depression. These are the people that should try a gluten-free whole food period. And the reason is this, is that gluten can cause a lot of inflammation for people. And it's a concept of something called the leaky gut syndrome, where the inflammation exists upon exposure of the gluten to the gut. And the gut can go through different changes in its architecture that decreases absorption of a lot of other vitamins and minerals, and also causes a lot of inflammation. And sometimes it can change the gut flora, and the gut flora is the bacteria that's in the gut. And that bacteria in the gut can talk to the rest of our body, causing a lot of inflammation. It can talk to the brain, causing a lot of depression and anxiety. And so when I suggest a gluten-free diet, I don't mean just a gluten-free diet. I mean a gluten-free, non-processed food diet. Eat whole foods and eat tons of vegetables and phytonutrients for people to combat inflammation. And so I do have a lot of people that have come in, especially with something like fibromyalgia, where they're on chronic pain medicines, and they say, "Doc, I want to get off my pain medicines. I want to get off my antidepressants. Am I able to do this using food?" And the answer is yes, we can certainly try. And there's a lot of people who have been very successful. However, there's a lot of people who have not been so successful because there's another concept of food addiction and sugar addiction, sugar substitute addiction, that has a much deeper foundation in people's mental psyche. All right. And so the whole idea behind gluten is that yes, it's heavily publicized. There's a lot of gluten-free items out there. It's heavily marketed, but you have to take into account that even if you go gluten-free, you still can be exposed to a lot of processed foods. So now I'm going to touch on the topic of whole grains. Okay. And the idea, there's many studies showing that whole grains may be good for cardiovascular health. Well, there's a stipulation to that. Now, whole grains and and these grains are grains, and they're gluten. They're wheat, whether it's whole wheat, not whole wheat, whether it's white bread, wheat bread, all these things, flour substances, they do contain gluten in them. And the idea is like, we were taught that these wheat bread, whole grain bread, whole wheat bread may be better for our bodies because of the higher amount of fiber that's within them. Yes and no. So yes, there are higher amount of fiber that are in these type of grains. But the problem is, if the grains are still causing the inflammation, you're not really getting to the underlying issue. Over the last couple of decades, we recognize now that strokes and heart disease and diabetes are diseases of inflammation. Right? They're not really diseases of cholesterol buildup. They're not really diseases of anything else or high fat diet. What they are inflammatory processes that happen in our body. And so when we talk about whole grains, we cannot ignore the fact that sometimes people may be gluten intolerant, and everybody is different. Not everybody is gluten intolerant. There's a lot of people who are, but not everybody is gluten intolerant. And so for those people, like I said, who want to try gluten-free, period, and they should try with gluten-free and whole foods and for an extended period of time. So how much time should they go gluten-free? And there's not a clear answer for this, because if you look at a lot of the studies with celiac disease, sometimes people with celiac disease can go gluten-free for 6 months and have one exposure to gluten and has significant inflammation for the next 6 months. So it's really difficult. Those people who are gluten intolerant are not very well studied, but my rule of thumb is try it for at least 4 weeks of fully gluten-free and see how you feel. And if you feel better, then great. If you don't, then try a little bit longer to see how you feel. And what do you mean by feeling better? And you'll know what you feel when you feel better, because a lot of people who are chronic pain, who are bloated, who have a lot of bowel issues, who have joint pains, who have abdominal pains, if those things start going away or completely resolving, then you know that you may be gluten intolerant. And there's also sort of a placebo effect, right? And the placebo effect is that people who are gluten-free pay attention to what they eat. They know exactly what they're going to eat because they planned it. And that act of planning and knowing what they put into their body gives them a lot of control over their food, when a lot of people are ignoring food because it becomes really habitual. So those people who are gluten-free, who pay attention to food, naturally tend to eat more whole foods, naturally tend to include more vegetables in the diet, naturally tend to have a lot more phytonutrients into their diet. And so they pick and choose what they eat instead of using habits to form their entire day. And so that sort of placebo effect is also going to exist in there. And the placebo comes to the fact that they have a lot of control of their food, they feel better about themselves. But hey, if that's a placebo effect, and I welcome that placebo effect, because it allows a lot of people control, and when you control one area of your life, like food intake, you tend to control others. So your depression becomes less, your anxiety becomes less. Overall, you're just a happier person. And so there's a lot to consider when we talk about the subject of gluten. There's good points, there's bad points about gluten, and there's malicious points about gluten for a lot of people who want to in the food industry, who want to market their items as gluten-free. And there's a lot of other different things, not just gluten, that you have to consider if you are wanting to go through your gluten-free period. So if you find this to be valuable, please share this video. If you don't find it valuable, comment in here and ask me those questions that you may have, that you may want to know, anything about gluten or gluten related, or about whole foods related. Okay? Thanks a lot, guys.